Hello, let me tell you that why do we need to check the blood pressure at home? And the reasons are you go to the clinic and you find out your blood pressure is very high. Is it because that you've been to a clinic, you are in front of a doctor, you are anxious, the blood pressure is high, or is it genuinely high blood pressure? And for that matter, what we need to do is that we need to check your blood pressure at home. Who is going to do that? You yourself are going to do the checking of the blood pressure. And what do we need to do there? We would check by this the fluctuation in blood pressure. We would come to know that what is the average reading. From there, we can always deduct that what is the ideal time to give you blood pressure medicine. So if I decided that, okay, I am going to take the blood pressure at home, then what all I need to do? So if I take the blood pressure, I should be relaxed. I should not be under worry. I should not be having headache, ache, or my bladder should not be full if I am checking the blood pressure at home, because all these conditions tend to increase the blood pressure. So I got to be relaxed. So a common myth is that blood pressure causes headache, but it's actually other way around. We have confirmed by a number of studies that it is the blood pressure which increases by headache. The headache comes first and then the blood pressure. In fact, any pain anywhere in the body, anxiety and stress would tend to increase the blood pressure. So there is no point taking blood pressure at that time. It is going to be high. So now what we do in case the blood pressure I have to check, you got to be sitting in the chair with arms supported and a back also rested, and it's a good idea to wait for 5 to 6 minutes before you start taking blood pressure reading. I advise that we should take reading once in the morning and once in the evening, and multiplied by 4 days, consecutive 4 days. So that is 8 readings in total of a blood pressure. So when do I take a morning blood pressure reading? When I get up, I fresh up, and before even a bed tea, I should take the blood pressure reading. And second reading is before dinner. So once I have done that, I am happy to say that the blood pressure taken by electronic equipments are fairly okay. So they are reliable taken if in case we take number of readings and average them out. Okay, and then what I do is that I maintain a record where I keep the chart of all those 8 readings, and then I consult my doctor to show the readings, and based on that the doctor would take a decision, and his decision would be so helpful that we will be able to manage the fluctuation in blood pressure. We'll be able to tell you what time the medicine should be taken, and you become a party to the treatment of a blood pressure. So we both are working together to reduce the blood pressure and keep an adequate control. Thank you very much. I am Dr. UP Singh from Prime Diagnostics, Chandigarh, and I hope this would be useful to you.